Hi everyone, welcome to my monthly video chat where I interview the best and brightest of Boston birth professionals. Today I am here with Robin Snyder-Drummond, and she is a IBCLC lactation consultant. And I'm really excited to have her here. I have a ton of questions. I know you're going to learn a lot. So without further ado, I'd like to introduce Robin. Hi Robin, how are you?
Hi, Angie. Thanks for the opportunity to talk to all the moms out there.
Yes, well, I'm so glad you're here. Now, like I said, you are an IBCLC lactation consultant, but you have a long history of working in the birth community. So can you kind of fill in the gaps for us and tell us a little bit more about you, your services, and your background?
Sure. I'll make it brief. I was a childbirth educator for 23 years, and at the same time, I was also an active doula. I did labor support and postpartum visits for about 10 years. So in that experience, I would see families before and during and after labor at their home and hospital. And I saw how really important it is to have that continuity, but also that you have to be really clear and consistent and really know your stuff about breastfeeding because the babies are really small and the moms are really tired. So that's why I first became a CLC, which is a lactation counselor. It's a 1-week training. That was good, and I put all together, it takes about 5 years to put your experience together, and then I got all my requirements done, and I sat for the exam, and I became an IBCLC. And now I mostly just do home visits for breastfeeding guidance.
Mm-hmm.
I do teach prenatal classes for breastfeeding. My experience as a doula was really valuable because I see that's the change over time through labor and back at home and all the influences that parents have. So it's great to be able to meet them at that crucial moment in the beginning.
Yeah, I think that experience that you have must be hugely, hugely valuable when
Yeah,
it comes
I'm
to
glad I did.
breastfeeding because
Yeah.
it's not isolated.
No, not at all. Yeah.
So
Yeah.
I love telling people stories
Mm-hmm.
because I think it really helps us relate when we can hear a story of someone else who has been through something in regards to breastfeeding and birth. So we can see like a little bit of ourselves in that situation and learn from somebody else's story. So
Yeah.
can you tell us a story of someone who reached out to you for help and was able to get some good assistance from you and so.
Sure. I think of one family in particular, and this is a good example of having trusted support and privacy, and also how birth can influence breastfeeding. So I had met this family in a prenatal class, so we had some rapport already. And the mom had been induced for a long time, several days, and then she had a long labor. So she was pretty tired, and she'd had a whole lot of IV fluids as well. When they got home, her in-laws were there, and everybody was focusing on this new baby, and the mom went upstairs and sat in the corner of her bedroom with the lights off and just cried. And her husband knew to call, and he said, I don't know, she needs something and I don't know what to do.
Mm-hmm.
So I went and visited them. So in a situation like that, you get to the house, and the mom's upstairs in a dark room crying by herself. What do you think the first thing you would do is? I asked the dad, I asked her about the in-laws. Are they helpful? Are you getting any support? And no, she wasn't.
Yeah.
And so the dad asked the in-laws, his parents, if they could just please come back. Then she had the house to herself. She was crying, saying, the baby only likes my husband. She doesn't like me. I have no milk. I can't feed her. So let's take one step at a time. We turned off the TV, washed her face, brought her downstairs. She had the house to herself now. Her breasts were really engorged. She'd had so much fluid over the past 4 days. So I showed her how she could do a little hand massage and expression. She got milk out. See, you have milk. We gave a little of that milk to the baby to calm the baby down. The baby drank that and was a little calmer. because the dad would let her suck on his finger, and that was fine. But when she got to the mom, she smelled milk and she would get frantic. So dad kind of calmly got some food in her belly. And we were trying to do a little more hand expression, but the mom wasn't entirely comfortable with it. So trusted support dad goes out to Osco at like 10 o'clock at night and gets a little breast pump, and he actually tries it in the store.
Oh my gosh.
To see if it had good suction. And then he brought it home. She pumped a little bit of milk. We gave a little bit more, finger feeding and spoon feeding to the baby. The baby calmed down. And then I just had the mom and the baby lie together, and the baby rooted around, latched on by herself, fed, great, fell asleep on the mom's chest. The mom is sleeping, the baby's sleeping, and the dad was just watching over them. It was great.
So amazing.
So they called early.
Yeah.
They got some space. She had good support from her husband and me or someone. And when I saw her, I kept in touch with her, and I saw her a couple days later, and her brother was visiting from another country, and we were sitting on the couch, and we were watching TV. We were watching some silly dog show. I know you have dogs, but it was like a dog show, and we're just sitting there eating shortbread, and she's nursing her baby, and I'm sitting with her brother, and it was great. It was fine.
It's just wonderful. It's just wonderful.
That was a nice story.
I love it. And I think so many women are in those positions where they're scared and they're overwhelmed.
Yes.
And if they can just have someone put a few pieces of the puzzle together for them, it just can make all of the difference.
When I see a family, I try to give them I review what's going on, hope they understand how their body works and what their baby's saying, and I give them some strategy for the next 24 to 48 hours, and we keep in touch. So email, phone, or another visit if they need it.
Yep.
I think people want it to be fixed in 1 hour, and sometimes it's not that quick.
Right. Because it's a more complicated process than I think most people think.
Yes.
You know, I see a lot of women for labor prep in my office, and I think most of them just assume that it's a natural thing, it happens on its own, I don't really need to think of it in advance, but when they sometimes realize that it can be a bit more complicated, and sometimes you just need to reach out for help.
Yeah. You know, and traditionally women had other women around, and they saw breastfeeding all the time.
Right.
And traditionally women would be at home without a lot of IV fluids and without being on a schedule or without having a C-section.
Right.
So things do get complicated, sometimes necessarily and sometimes not.
Yeah.
Yeah.
So as far as timing goes, do you recommend that women start with like a before they go into labor session or do education ahead of time? Are there things that women should look for in the early hours or first few days of breastfeeding that would be kind of like clues to them that they should maybe reach out? Like, how does someone know when they really should touch base with somebody? I mean, such a wonderful husband in this story that he knew, like, I need to reach out and get somebody who knows a little bit more about this than we do. But for other women who are just not sure, like, how do you help them figure that out?
So I definitely encourage prenatal breastfeeding classes because you can learn how your body works. The first couple hours and the first days make a huge difference in your supply and your comfort. So if you know what to do for yourself, that's great. Here's the general guideline. Number one, if you're in any pain, you don't have to tough it out. That's not necessary. If you're in pain, that's very valid. You need some help. If your baby is not peeing and pooping, and you always get a chart that says how many pees and poops per day. If they're not peeing and pooping, or there's little crystals in the urine, that means the baby's not getting enough. So let's look at that right away. If the nipple is pinched or cracked, or there's a little line on it, definitely that probably hurts. Call. So, or anytime your gut says, I don't know, I'm not quite sure, or I just want somebody to reassure me, just call. Just call. But the sooner the better, because the first first week, 2 weeks are really when your body is doing the most work to establish a supply. If you call that 6 weeks, it's kind of hard to boost your supply at that point.
Okay, so earlier better.
The earlier the better. And a prenatal class is great because you can ask a lot of questions. And then you have the baby, and it's a whole nother bunch of questions.
Yeah, right.
Funny how that works. Goes on for life like that.
So a lot of the questions or a lot of the concerns that I hear from my patients are about milk supply. And I know that women who struggle with milk supply or are questioning milk supply, that can be very, very stressful.
Yes, yeah.
So can you just talk to us a little bit about milk supply and in those situations, like when to call you and what are the types of things that you can help women with in those situations? So
if she has any concerns about milk supply, definitely take a prenatal class. But the milk supply, in the first 6 hours, the body is really primed for setting up that mammary growth. So skin to skin, early and often feeding, that sends the signal to the body. Brewer's yeast and herbs and stuff are great, but really the body needs the baby or the response of the breast gets full, the breast gets empty, the breast gets full. You need to go through that cycle and feel it, and that's how the mammary ducts grow. So my point is, the sooner the better. In the first day, the first 2 days, get some help. If the baby's not feeding well, start doing hand expression and pumping.
Okay.
So that's what I would say. Please don't sort of tough it out and the baby's losing weight and then at 3 weeks try to boost your supply. It's really most effective if you start right away.
Right away. Okay.
Yeah. There's some women who do have definite hormonal imbalances, and that's where you can come in. But that should be probably addressed a little earlier, like in their pregnancy and stuff.
Absolutely.
Yeah.
I totally agree. All right, Robin, so I wanted to ask you about insurance coverage, because you had mentioned that lactation consulting is covered by insurance, and I think that's an important thing for people to know about kind of in advance, because sometimes price is a hindrance.
So that's a great question. The Affordable Care Act requires, it's a federal requirement, that lactation support be covered. Lactation support from a lactation professional in the home, in the hospital, or in a clinic. No copay, no deductible. Not all insurance companies have been forthcoming with that. You can appeal it. You can also go to the National Women's Law Center, nwlc.org, and they will help you work it out. Most importantly, the Insurance Commissioner of Massachusetts issued a bulletin on July 6th of this year saying it's a federal requirement. No copay, no deductible.
Wow.
So I know you have a new baby and you're tired and you're fed up, and I know cash is a problem. Some of us take credit cards, but stick up for your rights, and the National Women's Law Center will help you. On my blog, birthready.com, on my blog, just search insurance and you'll find information.
That's so fabulous. And just to note, just so people know also, your website, which is birthready.com.
Birthready.com.
Birthready.com, you have a ton of resources on there and a great blog with a lot of really important information, so I do encourage people to go check it out. It's really, it's a wealth of information for them. So.
Oh, great.
And then the final thing, you and I had talked about how it's important to work as a team together, that birth professionals, which of course you can imagine I love. I am always promoting birth professionals, and it's because of this very issue, which is that, well, I'll let you talk about it, but the importance of working as a team.
Oh, I definitely think we all have something to contribute to a family, and that's the village.
Yep.
In the case that the story I explained earlier, what if the baby had a tongue tie? I could do X amount, but I have found working with chiropractors or craniosacral therapy to be fabulous.
Yep.
I saw a mom recently who had really severe mastitis, and I would suggest that she see an acupuncturist. Mastitis is like a stasis, a block of energy, and acupuncture is all about energy flow. So I have a scope of practice that overlaps and yet is much more enhanced by acupuncturists, chiropractors, craniosacral therapists for postpartum depression. All of us have something to offer a family.
I couldn't agree more, and I feel like that when it comes to fertility, I feel like that when it comes to pregnancy, when it comes to birth, and when it comes to both postpartum care, that there are so many. We are so blessed in the Boston area to be surrounded by just amazing professionals and people who really, really care about what they do and take pride in the quality of their services. And I just think we're hugely blessed in that regard, that we have so many people to choose from and so many resources right at the ready right here for us. So
yeah, I'm part of a group called LC Home Visits, and if somebody calls me and I can't see her, I can connect her with somebody else. We try to see people as soon as possible.
That's amazing.
Yeah.
Well, I thank you so much. I was just writing LC Home Visits down so I know about it myself, but I just thank you so much. I think that this information is so important for women to learn, and I really encourage those of you who are listening and watching to go to birthready.com, because Robin has some great information there. And so, Robin, you're currently taking on new clients?
I do all the time.
Yep.
Somebody calls me, and if I can't see them, then I will see somebody else. I'm actually teaching a class tonight called Returning to Work and Breastfeeding.
Ooh, I love
so
it.
if anyone's interested in that, let me know, because I'm trying to promote it at Beverly Hospital and Newton Wellesley Hospital.
Okay, excellent.
Or I'll teach it to your group of friends.
Yeah, I love it. All right, well, thank you so much for joining me today. I had a blast. I feel like we covered a lot of information. I have like 2 more pages of questions that I want to ask you, but I want to wrap it up. So thank you again. Take good care.
Thanks, Angie.
Bye-bye.